Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today, we're talking with Dr. Megan Brown of Hamilton Physician Group-Catoosa Campus. Thank you for joining us, Dr. Brown.
Thank you for having me.
Dr. Brown is a board-certified family medicine physician at the Hamilton Physician Group-Catoosa Campus. They're located at 45 College Park Drive next to Zaxby's on Alabama Highway in Ringgold. She treats illnesses and injuries and performs preventative care.
So I was born here, born and raised.
Wow.
So I went to Lafayette High School. I went to the University of Georgia for my undergraduate training, and then I went to Mercer for med school. So I'm a Georgia girl through and through.
I think that's wonderful.
Yeah.
That is wonderful news. I know it's hard to find spare time as busy as you are, but in your spare time, what are some of the things you enjoy doing?
In my spare time, my husband and I like to spend a lot of time outside. We've both taken up mountain biking recently, so we like to do that, or just take our dog out on hikes.
What kind of dog do you have?
We have a miniature golden doodle named Ollie.
Golden doodle?
Yes.
Is that a golden retriever and a poodle?
Yes, it is.
A golden doodle. Oh, and what's his name?
Ollie.
Ollie.
Yes.
It's a little boy.
Yes.
What made you choose to become a family medicine physician? With all the different things you could have done in medical school, what made you choose to be a family medicine physician?
I was really drawn to family medicine just because of the variety of illnesses that you see, and also the variety of ages. And also there's a focus in family medicine on prevention, which is kind of unique. In a lot of other specialties, you focus more on treating disease once you get a disease or an illness. But in family medicine, we're lucky to be able to help patients prevent the disease before it happens. So I really enjoy that aspect of it, just trying to help people live healthier lives so that they can actually avoid disease in the future.
Right. I understand. That's very important. What is your favorite part of the job?
So aside from the prevention, it's also really neat to just be able to treat the entire family. We treat from ages 2 to 102. So you get to know people and you get to know their whole families. You can really see how that aspect affects their health. And you get to see them go through different phases of life. I get to see babies grow up and hopefully treat them as adolescents and even adults. So that's a really neat aspect of care.
I think that's wonderful. Tell us some things about Hamilton Physician Group, the Catoosa campus, where you are.
We have our primary care, which is what I primarily take part in. And then we also have our convenient care. We have neurosurgery and spine. So I'll speak more about the primary care since that's the part that I do, and also the convenient care services that are offered. Both of these practices provide personalized medical care to adults and children. As I stated before, we see ages 2 and up. The convenient care practices within our same building, and they offer walk-in care with no appointment and even evening and weekend hours, which is nice. We treat, mild illnesses like sore throat, earache, cold and flu, sinus issues. And we can also stitch lacerations. We can take care of musculoskeletal issues like strains and sprains. And as I mentioned before, we do a lot of preventive care. So we do annual physicals. We can get people their flu shots, pneumonia shots, tetanus shots, get them set up for their colonoscopies and their mammograms. And we manage a lot of chronic conditions like diabetes, hypertension, thyroid disorders.
My goodness, you guys cover it all.
We sure do. We try.
That is something. I have learned a lot about diabetes since I became a patient over at Hamilton, and I think it's wonderful because you guys are so good with so many different things, and diabetes is close to me, so y'all are so good with the diabetes.
Yeah, and that's the nice thing about family medicine is we are trained in all areas of medicine. Mm-hmm. So we can treat most things, and if we can't, we can refer you to the appropriate specialist. As I said, we do have the endocrinologist there. So if it's a more complicated case, then we can always refer you to them.
Tell me about, now I love the name convenient care. That is just it's convenient, and
Exactly.
it's so cool. Tell me, why is convenient care so convenient? Why is it so convenient?
Sure. So it's convenient because you don't need an appointment. And we can treat a lot of things that are urgent. And so you can avoid going to the emergency room. That's the goal, is to help patients prevent a trip to the emergency room, which is going to be much, much costlier. So
Right.
it's a big money saver. Also, we're open after hours, and we're also open on the weekends. So that's really nice for patients. They can walk in at any time after work or on the weekends. We have x-ray in-house. So if you fall and think you might have a broken bone, we can tell you right there on the spot. And it's convenient also because we take most insurance plans, including Medicare and Medicaid, and we have multiple locations. So I'm in the Ringgold location, but we also have locations in Dalton, Varnell, and Chatsworth.
Wow, so lots of locations, convenient hours, open after hours, and weekends.
Exactly.
Wow, that is fantastic. So I love that name for convenient care. You're a family medicine physician. Tell me, what exactly is a family physician?
So, family medicine is a medical specialty that focuses on the overall health of people and their families, as the name implies. Family doctors care for people and their families over long periods of time, as I mentioned earlier. So, you're kind of the patient's primary contact with the healthcare system. If they need a referral somewhere, you can get them to the correct specialist that they need to see, but you're kind of the middleman, just making sure that all the tasks get done. The patient sees all the different doctors they need to see, make sure that the doctors are communicating with each other. And also, as I mentioned before, we focus on preventive health care. That's a huge part of family medicine, trying to keep people healthy so that they don't need all of these other tests and specialists and things of that nature.
You know, a lot of people wish they would have listened. A lot of older people wish they would have listened in their younger years, and that's what you're here to do, help.
Yes, exactly.
That's wonderful. Treating the whole family, that's got to have a lot of advantages.
It does. You know, you get to know different families and their family history. So if heart disease or a specific kind of cancer runs in a family, you know to look for those things in the younger generations as they come along. If someone is diagnosed with a viral illness like flu, you are aware of those exposures and how to treat their family members. And also, the thing that I've noticed that is really helpful for families is they can all go to one place. So instead of a mom taking her 5-year-old and her mother to 2 different doctors, they can all come together. So that eliminates trips to the doctor's offices, and it just makes it more convenient.
Oh, that is wonderful. With plenty of locations, after hours, weekend hours, it'll save a trip to the emergency room. That is wonderful. One of the things that is important is an annual physical. Why is it so important? Because sometimes you forget to schedule it. Why is an annual physical so important?
Yeah, it's very important, and it can help to kind of try to get it at the same time each year and around the same month each year. And they're really important because you can find a problem before it starts. For instance, if we get you scheduled for your screening colonoscopy, you can find a colon cancer before it turns into a colon cancer and actually remove it. So medicine has come a long way in terms of screening, and there are a lot of diseases that we can actually prevent by having people come in yearly and get their age-appropriate screenings, not only tests like colonoscopy, but also lab work, checking cholesterol to assess for the risk of heart disease and other things like that you can prevent. 25% of Americans actually don't have a primary care physician. And so for those that don't, I would really encourage them to find a primary care physician that they can trust and that will listen to them and their concerns and get them the care that they need.
And you can take care of that for them.
Absolutely.
They can come in and see with those extended hours and weekend hours. It is so important that folks have that annual physical and they're able to do those tests that they need to do? You say age-appropriate test, younger, older. Well, one of the things that a lot of us have never been exposed to, and I'm one. I have never had anything to do with telehealth until recently. Tell me about telehealth. How does that work? What is telehealth exactly?
It's a really great alternative, and it's easier than most people think. We can use it for primary care and convenient care both, and you use your smartphone, your tablet, or your computer, and you can have a face-to-face visit with your healthcare provider from your home or wherever you are. I've had people out in the store when I called them for their telehealth visit.
Oh, they're at the grocery store?
Yeah, which I wouldn't recommend, by the way, but it has happened.
I'm sure, yes. It's interesting. What if I had an earache? If I had an earache and I called to schedule a telehealth appointment, what should I expect?
Yeah, so after you schedule your appointment, we will either email or text you a link to the meeting, and literally all you have to do is click on that link and a video screen will appear. You and your healthcare provider will talk about what you're experiencing and come up with a plan. If we prescribe a medication, it will be sent electronically to your pharmacy, and if you do end up needing lab tests or x-rays, then we'll ask you to come into our office for that. But in a lot of cases, these things can be taken care of with just a conversation about symptoms. And so telehealth is a great option.
That is something. Dr. Brown's with us. You're on Health for Life, Hamilton Physician Group-Catoosa Campus. Dr. Brown, great to have you here. A couple more questions before I let you go. It is important to find the right primary care provider for you. What do you think is a good way to choose a primary care provider?
Yeah, I think it's a very good question. It's very important to choose the right primary care provider because when you can work as a team with someone, you'll just get better health care. I think you should look for a doctor who listens to your concerns, listens to your questions, encourages you to ask questions. You need to find a primary care physician who's going to take the time to explain things to you. It's obviously an added bonus if they're experienced and board certified, and takes your health insurance. Check with your insurance to see which physicians are included. And we accept most insurance plans, including Medicare and Medicaid. If you're not sure, you can always just give us a call and we'll be able to help you out with that. Also, finding someone who's close to home or your work, just somewhere that's going to be convenient so it doesn't take you a long time to get there and take a big chunk out of your day, because that can be really frustrating.
Well, I'm sure you're right about that. Now, I do have a quick question for you, because let's say, for instance, I have a primary care provider and it's not at convenient care. Can I come see you because I couldn't go to my primary provider, and then maybe you send them the information they need to know?
Absolutely. And that's the nice thing about our office. We do function as both a primary care and a convenient care. So we do see a lot of patients who have a different primary care provider, but because they're not open on the weekends or after hours, they'll come see us for urgent concerns that come up.
That's great. That's fantastic. Now, if I want an annual physical, if I'm thinking it's time for my annual physical, before I go see you, is there anything I need to do?
There are a few things that you can do. You want to review your family medical history. Think about different disease processes that run in your family, like certain cancers, heart disease, diabetes, hypertension. Those things are going to be important for your physician to know. If you think you've had, say, the pneumonia shot, but you're not sure when it was, if you can find out when those things were done, that would be really helpful.
As a family medicine physician, tell me about some of the services that you have for women.
Yes, so in addition to our regular primary care services, we provide women with care that they may be used to getting from a gynecologist. For instance, I do a lot of pap smears to screen for cervical cancer. We can also prescribe birth control. You know, the nice thing about family medicine is we are trained in so many different fields. So not only women's health, but we're trained in, for instance, psychiatry. So we do a lot of mental health. But family medicine really covers the spectrum. So women's health, psychiatry, and all different forms of medication we can provide.
No idea that you went into mental health also.
Absolutely. It's a very important part of just overall well-being. So it's really important that patients are paying attention to that along with their physical health.
That is very important. A lot of information today. Thank you so much for being a guest with us here on Health for Life. For more information about Hamilton Physician Group-Catoosa Campus, call 706-965-4060. 706-965-4060 or visit hamiltonhealth.com/Catoosa. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System. This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.